Good afternoon and welcome to the live stream event. This is Dr. Joseph Nemeth. He is here to discuss periodontal disease and answer any questions that you may want to ask of him. And Dr. Nemeth's a periodontist. Do you want to say a little bit more about yourself?
It doesn't just have to be about periodontal disease. It can be anything regarding your mouth or anything in dentistry, although I do specialize in periodontics. I'm a periodontist. So we're open for questions, and I think this will be interesting. So hopefully we'll have some interesting questions, and I'll do the best I can to give you the best possible answers I can. By the way, if my face is red, which it could be, I just took my niacin. Now, I take niacin every single day because I think niacin is helpful. It helps increase HDL, which is a very important aspect of cholesterol. So if I look a little red and if I keep scratching myself, that's what niacin does. So here we go. Let's see what kind of questions we have.
All right, here is the first one. Doc, are good teeth basically genetic? I have never visited a dentist until I was 17. I never flossed until I was 23. I've only had 3 minor cavities, and I'm 50 now. I've never had a toothache. My father was the same. Never lost a tooth until he was 68 and had leukemia causing the loss of his teeth.
I would have to say there is a partial genetic component to teeth, to good teeth. So yes, to some extent that's true. So, you know, there are so many factors involved here. First of all, you may never have had a cavity. Maybe you had a lot of fluoride, which prevented cavities. Maybe you learned good oral habits from your mother or your father, and that helped you to have good teeth. And maybe you have a resistance, an inherited resistance to the kind of bacteria that cause gum disease and decay. So there is, in my opinion, a genetic component to good teeth. Is it the only factor? Absolutely not. There are so many factors. So you're a rare individual who has not had any significant problems. But the fact that your father lost all of his teeth when he had leukemia, that still doesn't sound right. That shouldn't have happened. If he really had good bone and really good teeth, leukemia doesn't necessarily mean you have to lose your teeth. So something, you know, there may have been something else that you did not know about.
Well, I have a question of my own. As I was growing up, I have always heard that gum disease and tooth loss is basically an older person's disease. But I'm just wondering, can a younger person have periodontal disease too?
Actually, yes, although we actually see it in younger people. But because periodontal disease tends to progress so slowly, we see the effects generally in older individuals. So it may start when you're a young individual in your teens or early 20s, but it progresses generally very slowly. On the other hand, a couple of days ago, I had a 24-year-old man who had very severe, very advanced periodontal disease, although if you looked at his mouth, it looked great. Gums looked healthy, but once we looked at the x-rays and we saw that 80 to 90% of the bone was gone, and the vast majority of his teeth were very loose, it was an outstanding case, an unusual case. And so I did ask him about his genetics. How about his mother? No, his mother was fine. His father, I think his father may have lost one tooth. But then I asked him about his grandparents, because sometimes genetic forms of periodontal disease can skip a generation. So generally we see it in older people, although it starts often in younger people but progresses slowly, but there are exceptions. And this young man was truly an exception, but we're going to do the best we can to stop the progress of that disease and save every tooth we possibly can, even though some of them are very, very loose and have lost 80 to 90% of their bone.
So
Well-
we've got some live questions coming in, if you don't mind.
I don't mind.
So
Let's hear
someone's
them.
asking about tonsil stones. Nexus says, any advice on tonsil stones and how to get rid of them?
I have a great answer for tonsil stones, and it's sitting right next to me. Doreen is the tonsil stone queen. So Doreen, why don't you tell them a little bit about tonsil stones? You know, we have a whole bad breath center here. And one of the banes of our bad breath center is tonsil stones. So Doreen, why don't you expound briefly on that?
Well, tonsil stones don't happen to everyone who has tonsils, but tonsils are basically like sponges. And so, and they have little cracks and crevices and holes in them. And if we have a patient who is concerned about having a breath malodor problem, occasionally these same bacteria that populate the tongue and the papilla on the tongue will also collect in the tonsil crevices and create what's called a tonsil stone. And that tonsil stone usually remains intact until it gets big enough and it either falls out on its own, or you cough it out, or we can actually, work it out here in the office.
But those tonsil stones can be a major source of malodor or mouth odor. In fact, isn't it true when you've gotten some of those tonsil stones
Yes.
out that the odor that has been generated by them, which is now freed up, can be extremely, extremely strong. Another name for tonsil stones is tonsilloliths or tonsilloliths. Lith meaning stone, I believe. Okay, what else? By the way, Beth, you were gonna tell me about a very common question that you have, because we have a lot of people who call in to make appointments, and Beth gets all of these questions, and so she has some interesting questions. One particularly.
Yes, and I get a lot of emails asking this as well. We have a lot of people that email in saying that their dentist or their doctor, periodontist, whoever it is, says that they need to pull all of their teeth and they're very loose. Is there a way they can be saved? What can they do?
We get a lot of that happening. A lot of these people really do need dentures. A lot of them don't. I get a lot of patients who are, I'm sort of, for them, I'm like where the buck stops. I'm the court of last resort, so to speak. And some of these patients have been told they have to lose their teeth, and they do have advanced periodontal disease, and they do have a lot of loose teeth, but they're not having any pain. They're not having major infection that's visible. And very frequently, if we can stop that infection, and very frequently we can extend the life of those teeth and maybe save those teeth for a very long period of time. So sometimes teeth have to be lost, and when they do, and we do implants to replace those. But very frequently, teeth that are thought to have to be lost don't have to be lost. So the only way to really know is to actually see the patient, and that's the way to truly evaluate it. Sometimes x-rays can help also.
Is there a way, or can we describe to the people that are listening or watching, where are the different places that bad breath can come from? People think, oh, it's my mouth, there's automatically something there, but there are other places, secondary issues that can cause bad breath.
Bad breath can come from onions, garlic, if you're eating fermented foods, if you're on a diet, all of those things can come from your lungs, and there really is no way to get rid of that. But we do have a treatment for chronic bad breath, which is caused by bacteria, and once we determine the form of those bacteria, what kind they are, we almost always can eliminate that problem. So you had said you had some more live calls?
Yeah, someone else was asking, vitamin C, funny name. Hi, Dr. Nemeth, can I put mouthwash in the water pick? And should I?
Did you say vitamin C?
That was their username, yes.
Can they put mouthwash in the water pick?
Yes.
Yes, you could put mouthwash in the water pick, but I wouldn't put a lot in. I would put a small amount in, depending on the mouthwash and the strength of it. Also, sometimes the mouthwash can accumulate in the water pick, and if it's not flushed out completely, can affect the function of the water pick. So you can use mouthwash in it if you feel comfortable. Make sure the mouthwash is well diluted, because if it's too strong, it can actually cause overgrowth of certain bacteria that can be harmful.
Well, here's another question since we're discussing mouthwash. I've been reading up on using mouthwash, and they're saying it's not good because it depletes the nitric oxide in your body, which isn't good for your vascular system. As you get older, your body produces only about 15% by the time you reach about 60 years old. This can lead to heart attacks or strokes. I guess the interior of your arteries need the nitric oxide gas. I was wondering if you ever did a video on this subject or would do one.
I may have touched on this in a video. So actually, this call, let's call him a caller. This caller has a point, because there are bacteria in the mouth that are very important to producing nitric oxide. And if you're using a mouthwash that is too strong, it can kill these bacteria. And if these bacteria are killed, studies have shown that blood pressure may actually increase. So you don't want to use really strong mouthwashes, particularly if you have a tendency towards hypertension. So mouthwash is important. I think it's okay to use it, but some of the very strong mouthwashes, particularly if they're not diluted, can kill these bacteria, and that can actually cause an increase in blood pressure. So that's a good point.
Let's go right on down the line.
Okay. Another question is about grinding teeth. I'm grinding my teeth. I was given a mouth guard by the dentist, but it's uncomfortable to sleep with the mouth guard, so I don't use it. Is there a more comfortable solution for grinding teeth, or a different kind of a solution, such as relaxing your muscles or something?
Well, it's great to relax your muscles, but when you're sleeping, let's face it, it's really hard to do because you just don't have control of that. But there are several solutions. First of all, mouth guards. We generally make mouth guards for the upper arch, for the upper teeth. Those mouth guards can be made with thinner material, so they don't tend to be as bulky and they're more comfortable. They can be made so they don't extend as far back into the palate, which may be gagging, so that can be more comfortable. Mouth guards can be made for the lower arch instead of the upper, and those are much smaller, and those can be more comfortable. So I think a mouth guard is helpful. I think a mouth guard is important. We suggest it for almost all of our patients. And the best thing to do is try different kinds of mouth guards that are made of different materials or different shapes that are more tolerable for you. And sometimes they're simply not. Some people just take them out at night without even being aware of it. Not much you can do about that I know of, but if you try enough, you may be able to find a mouth guard that really is comfortable and works for you.
So we've had Benjamin asking from the very beginning of the stream. He's asking about the guy that came in here that hadn't brushed his teeth for 20 years. He was asking how many cavities and or abscesses did this gentleman have?
This gentleman had 0 cavities, had 0 abscesses, which is quite remarkable. Of course, his wife left him because his breath was so bad that she couldn't tolerate being around him anymore. So he had a big cavity in that part of his life. Or lack of thereof. I'm sorry to go there, but at any rate, he had heavy, it was like cement. It was like cement around his teeth, and perhaps the cement actually prevented the decay. The bacteria couldn't get through the cement to cause the decay. His gums were inflamed, but he didn't have a lot of bone loss, which was very, very interesting. And there are some people, as I mentioned earlier, that simply have a resistance to the kind of bacteria that cause gum disease. When I practiced, I was in California when I was practicing in Beverly Hills. I had a physician. Every time he came in, cleaned his teeth, blood poured out, blood poured out. I mean, I didn't know as much as I know now. But this physician had not lost a drop of bone. And I still remember that. A very interesting situation. So everybody's different. Everybody's susceptibility is different. So you really, you really don't know. But this man had a horribly, encrusted mouth, but amazingly didn't really have any cavities and really didn't have any significant bone loss. So there you go.
Very nice. Okay, so we got a new person joining in. Someone says, "Hi, I've had a root canal that still hasn't settled after being dressed with iodine. Should I give up on the tooth or should I give it longer of a chance?"
Give up on the tooth. No, I'm joking, of course. No, if you've had a root canal and it hasn't settled down, go back to whoever did the root canal and say, look, this thing is still bothering me. What can I do? There's lots of options. It's possible that the root canal wasn't completed. There may be accessory canals that didn't get filled. And sometimes root canals fail. They don't always work. But sometimes if you give it some time, it will settle down. So without seeing you, it's really just really hard to know. But I would certainly go back to whoever did the root canal and say, look, this is what's going on. Can you help me?
I also get a lot of calls from people who are petrified, terrified, have a horrendous fear of the dentist or the periodontist. And they're
not the periodontist.
They're afraid of anyone doing anything to
I
their
get
mouth.
it. I get it.
And I know there are a lot of things that have been advanced over the years, and there are a lot of things and options that can help them get over that, and things that can be done in the office. How can they know what to ask and what to look for when they go into the office, and how that can be helped, how they can overcome that?
Well, something. Put yourself in the patient's place. That's what I try to do. And we try to do everything we possibly can to make the patient's experience, and I'm sure most dental offices do this, make the experience as comfortable and as pleasant as possible. So, if we're doing anything major, we generally use IV sedation so the patient's completely relaxed and at ease. And when we give local anesthetic or the Novocaine, usually they're very relaxed, may even be asleep, so they often don't remember that. We do have nitrous oxide or laughing gas, which can make a big difference. We have topical anesthetic. We try to play boring elevator music, which sometimes soothes people too. So can you think of anything else, Doreen, that we're doing to keep these patients comfortable? Sometimes patients just have to have the experience of a positive dental experience, because we've seen patients like that here, and for the most part, after they've completed treatment, they have a really very different view and less fearful view of the dental office than they had before, and it's a service that we feel really good about.
Very friendly office staff too.
Yeah,
friendly.
Yeah.
Mm-hmm.
I try to get an office staff that makes up for my personality. They're nice.
Well, here's a question that kind of goes along with what you asked earlier, Beth. I've randomly had all my teeth become loose 4 months ago, and it's gotten worse as time goes on. But everyone just says my bone loss is at the most 2 millimeters and my recession is there but not horrible, so no one can tell me what's going on and how to fix it. I feel like I'm just sitting at home waiting for my teeth to fall out. I'm curious if this can actually help if there is any help with pretty loose teeth. Someone suggested I try, but it sounds...
If what can help?
He doesn't say exactly, but...
Just this can help? Okay.
So I know we have something that can help, and he also is wondering if it's expensive, what we have to help.
First of all, it's really hard to know what's causing you to lose teeth. I can't say for sure. If you're here as a patient, I can give you a better idea, but there are so many things that can cause what seems to be sudden loosening of teeth. Very frequently, orthodontic treatment, or what's called Invisalign. When these teeth are moved, those teeth can become loose. Very often they tighten up again, not always. Sometimes if orthodontic treatment is done for a long period of time, the roots that hold the teeth in the bone, those roots actually tend to be absorbed or shrink. And when the roots of the teeth are smaller, there's less holding them in. And that can cause loosening or movement of the teeth. You may have a kind of a generalized, let's call it a viral infection where the gums are swollen and inflamed. That also can cause loosening of the teeth. But if you have gum recession means you've lost bone. When gum recedes, bone recedes with it. So the gum recession may be a factor, and you may simply be aware of the loosening of the teeth, the rapid loosening of the teeth, not that it has been rapid, but it's reached a point now where all of a sudden you're feeling it. It's been going on for a long time, and now you're more aware of it. It doesn't mean that it happened suddenly, but it's reached a point where now there's so little bone in some of these areas that even you've become aware of the looseness. Most people are not aware of their loose teeth until we actually see it and point it out to them. So there are many factors that can cause loose teeth. Grinding or clenching at night can contribute to it, and sometimes a night guard would help. To see your dentist and see if you can get some more accurate information, get some tests, and see exactly what's going on. Sometimes X-rays can help. Hard to know without seeing you, but these are just some of the thoughts that come to my mind.
What stage of periodontal disease when the gum pocketing reaches 2 to 3 millimeters?
In my mind, 2 to 3 millimeters is very early gum disease. I would call it gingivitis. So there's two primary kinds of gum disease. There's gingivitis, which is the early form of gum disease, where the tissue may be red, inflamed, it may bleed, but there hasn't really been bone loss. In those situations, 2 to 3 millimeter pockets is not unusual. If the pockets start getting deeper, that typically means that the bone is now involved, and one is losing bone and one is losing bone. Then it's gone from gingivitis to periodontitis. Perio is the supporting structure of the teeth. Perio meaning around, dont, tooth. You're losing the bone around the tooth when it's periodontitis. Gingivitis, usually reversible, early stages, not as severe.
Here's a good question that hasn't been touched upon yet. I have braces and my gum is swelling up, but I water floss every day and brush my teeth every day very thoroughly, and it's still swelling.
Read that one more time. So this person water flosses every day, brushes thoroughly every day. What else?
Their gum is swelling because they have braces, and all of this brushing and flossing.
I see this. I very frequently see this. They may brush and they may floss, but braces have a tendency to irritate the tissue. It may trap food particles, bacteria. So we very frequently see swollen gum tissue when braces are in place for various reasons, and very often that swelling goes away when the braces are removed. Sometimes it doesn't go away, and when it doesn't go away, we do something called crown lengthening or reshape that gum tissue to give the patient back that beautiful smile that they had before the tissues got swollen.
I had a question, somebody asked if they use the water flosser on the low setting, is it still effective?
On the low setting, it's still effective. And in fact, if your gums aren't healthy, the low setting may be the safest way to go. I love the high setting, but only if the tissues are healthy. Because if you're using the high setting and your tissues aren't healthy, you can drive bacteria and material into these pockets and possibly cause more problems. I recommend a water irrigator. It doesn't have to be a water pick. They now Sonicare, I think now has, was it Sonicare? Sonicare now has a water irrigator device that we tested, and I thought that was very, very good. But high pressure, if the tissue is healthy, if it's not healthy, you really have to be careful. There should be no bleeding of your gums ever, and that is one of the signs of health or non-health, and that's bleeding. So very often patients will come and I'll say, do your gums bleed? And they'll say, well, not really. What does not really mean? Really means they really do bleed. But they say, well, only if I'm really brushing hard or really only if I'm flossing. Gums should never bleed, whether you're brushing hard or soft or flossing or not. Gum bleeding from your tissues is not a healthy, normal thing and shouldn't occur. It's giving an opportunity for parasites and bacteria to get into the bloodstream from where that blood is coming from and cause all kinds of effects, not only in your mouth, but the whole rest of your body.
That's great. And we've been live for almost a half an hour, so we'll take a couple more questions and then close out the segment. But someone is asking, her name's Linby. She says, since she started using an electric toothbrush, her gums seem to have receded a bit. Is this common?
Yeah, it's really not unusual because very often the electric toothbrush can be a little bit more traumatic and put more pressure on the tissue. And if you brush too hard or too frequently, or the brush is too hard, you actually can traumatize the tissue and contribute to recession. In fact, we have patients that we treat for recession, and when we teach them to use a brush, if they want to use an electric brush, they have to use it very carefully, holding it between two fingers so that they cannot put a lot of pressure on. So that recession with an electric brush that she hadn't used before is a real possibility.
Great. And then we've got another one that just came in from PS 5849. I have cavities on both of my wisdom teeth. Should I get them removed?
It's hard to say. Again, you never know. I like to save every tooth there is, but wisdom teeth are hard to clean, and I think it would not be unreasonable to remove those wisdom teeth if they have cavities, because if they do, they can be a chronic source of problem, and if you still start having problems with the wisdom teeth, it can contribute to the problems adjacent to the wisdom teeth. So I can't say for sure. Of course, I can't say any of this stuff for sure without seeing patients, and these patients should all see their general dentist and ask those questions. But wisdom teeth removal, if the wisdom teeth are a bit of a problem, I think is perfectly appropriate.
Great. We've got more questions coming in if you want to keep going.
Well, let's give it 5 more minutes.
Perfect.
And then I have to get out of here.
That's great. So someone's asking, how much truth is there in stating that bone loss in the canines is the worst place to lose bone? Is there a reason that they graft them more frequently over molars?
Well, the canines tend to be very important teeth. They're sort of the foundation of the arch. They're in the corner, and they have long roots, and so they're very strong teeth typically. And so it's important to have those teeth, particularly if you're losing other teeth. You need anchors. Those teeth usually serve as anchors, and so the canines, because of their location, because of the long roots that they have, are very important to try to retain if possible. They also tend to get a lot of recession because those canines stick out more, and when they stick out more, the gum is thinner there, and we frequently will do gum recession or pinhole grafting techniques, particularly around the canines, to stop that gum recession. Because when the gum recedes, the bone recedes.
Great. So Nada asked a question in the beginning, and she reminded us now that it has gone unanswered. And her question is, does gingivitis cause severe pain? Because she's had severe pain in the area between her upper gum on the left side and hard palate. Do you think it may be gingivitis, or could it be caused by something else?
I think it's caused by something else. Basically, gingivitis usually doesn't cause much pain. Gum disease, periodontitis, which is a more severe form, usually doesn't cause much pain. That's the whole problem. If gum disease caused pain, people would get it attended to, but they don't know they have it. It doesn't cause pain. It's insidious. It gradually destroys the bone, and by the time people really have pain or are aware of it, teeth are ready to fall out or have to be pulled out. That's why we rely on the dentist to refer us those patients or to treat it and catch it early. It's like high blood pressure. I call it a silent killer. It's the other silent killer because it doesn't just harm your mouth. Those bacteria get into your bloodstream and affect every organ in your body. But the problem is it doesn't generally cause pain, and I would be very surprised if the gingivitis she has is responsible for her pain.
Great. Maybe one more from you, Doreen?
Judy Young.
Is there any advice you can give for an almost graduated or newly graduated dental student? And from your perspective, what do you think makes a great dentist? What qualities should we have, and how to stand out in a crowd?
I think what's really important is to keep up on the literature. Make sure you read everything that you possibly can about what's going on in dentistry, what are the latest techniques, what's happening in especially if you're a specialist and even if you're not. Read the literature. Read. That's critical. Number two, be the patient. Be the patient. That patient is a human being. You want to be a great dentist. You've got to take care of that patient. That patient is your first priority. So just empathize with the patient. Be nice to the patient, and do quality work and keep up with what's happening. Take courses, read the literature, and listen to your patient and help them truly with your heart.
This last comment is wonderful, and I think it's a good way to close it out. From it is your hamster. After finding your channel, I bought an ultra soft toothbrush. I've been using the water pick, and I've been doing the diluted bleach mouthwash twice a week. And I just wanted to say thank you so much for how much you've helped my gums and how much my teeth have improved.
Listen, my goal is to get you guys as healthy as possible. Really, that's my goal. I want you all to be as healthy as possible. I want you to look great. I want you to be healthy. I want you to be able to function, because you can't be healthy. What? You can't be healthy if what?
If you've got disease in
If your mouth isn't healthy, you can't be as healthy as you can be, as you should be. So just remember, healthy mouth means a healthier body. Subscribe to our YouTube channel. We'd love to hear from you. So it's been a pleasure trying to answer these questions. I hope I've been helpful. And I'm going to be, I think I'm going to be on WJR Radio next Tuesday night. And there's going to be March 8th. There's going to be a full hour. And I think there's going to probably be a nationwide audience. We've even gotten calls from Ireland and all over the world. So on WJR next Tuesday night, the 8th at 7 o'clock on the 8th. Anyway, thank you, Skylar, Beth, Doreen. Thank you all so much, and I hope I've been helpful.
Yes.
Take care.
And he loves this, and he lives it.
Absolutely.
That's true.
And
Very true.
on that note, if you guys liked the stream today and you want us to keep doing more of this, write in the comments section a date or a time that might work for you, because we're considering doing more of these and we're going to keep improving. So any feedback is definitely helpful.
Take care.